Well, now, to discuss the growing humanitarian crisis, let's get to our panel. With us in Washington is Daniel Lucey. He's adjunct professor, Department of Microbiology and Immunology at Georgetown University Medical Center. Joining us from Los Angeles, Ted Alemayhu is founder and president of U.S. Doctors for Africa. Olivier Le Polain is senior epidemiologist and deputy director of operations on the UK Public Health Rapid Support Team, and he joins us from London. Thanks to all of you for being with us. Daniel, let me start with you right here in the studio. The Director General of the World Health Organization, known as the WHO, has been talking about this outbreak of Ebola. Let's listen to what he had to say.
Just when we start to get control of the virus in one area, it appears in another. And violence and insecurity continue to undermine the response. We're dealing with one of the world's most dangerous viruses in one of the world's most dangerous areas.
That was the Director General of the WHO speaking over there, Daniel, and he encapsulates it. He tells us what the problem is all about. This outbreak, as we just reported, has now reached the city of Goma. That's a city of 2 million people. It's a major transit hub as well. How serious is this?
Well, if there's transmission of the Ebola virus in this large city of Goma, with the international airport right on the border with Rwanda, then that's very, very serious. But to the best of my knowledge as of today, the DRC public health officials were able to prevent any transmission of the Ebola virus in Goma after the first patient arrived there back on Sunday, July the 14th.
Right. Do you get the sense, Daniel, that the health workers in the area, in the region, on the ground, are getting a grip on this, or is it getting worse?
Well, I think that the effort by the healthcare workers is really valiant. It's courageous, and it's been going on for basically 12 months. But despite that, we still have quite a few new patients with Ebola diagnosed every day, including patients that have never been identified before, and they die, they pass away in the community. They haven't come in for treatment. And when someone dies with Ebola in the community, it means that they could well have infected other people. So in that sense, the epidemic is definitely not under control.
All right, let me go to Olivier Le Polain. He's in London. And Olivier, these are remote regions where the disease has broken out, difficult terrain. What kinds of challenges are health workers facing there in trying to combat this outbreak?
There are many challenges in this outbreak. One that was mentioned already is certainly the security context, which makes it difficult for teams and for response team to operate in highly insecure areas when a patient is found or when someone develops symptoms in that area. Bringing a patient to a treatment center or undertaking public health interventions in highly insecure zones is difficult. But aside of security, this is a complex area for many other reasons as well. The outbreak is happening, unlike previous outbreaks in the Democratic Republic of the Congo. This outbreak is occurring in a densely populated area. You have a lot of trade, a lot of movement of people within the province, between provinces as well. And potentially that brings also the risk of actually contacting a lot of people and a lot of people in different places. The main challenge, one of the main challenges as well, which the outbreak is facing, and that was certainly evident from the start when we were, and I was on the ground there earlier on, is that you have numerous healthcare facilities. And people have access to thousands of healthcare facilities in an area, but the quality of infection prevention and control is relatively poor. And this brings challenges for control because a lot, or to some extent, those healthcare facilities have contributed to fueling the epidemic and allowing the virus to spread from patients who are perhaps incorrectly isolated. So one of the main challenges for respondents is really to ensure that you've got full engagement of frontline workers in those communities, that you have mechanisms in place to recognize potential individuals with Ebola-like symptoms, to be able to isolate them and to be able to provide them some treatment. And as the outbreak continues, I'm sure all efforts are being made to strengthen the various elements of that response that are being put in place.
All right, let me bring in Anthony Fauci at this point. He is director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. He joins us from Bethesda, Maryland, not far away from where we are sitting right now. Anthony, thanks for joining us. In 2014, Ebola killed 11,000 people in West Africa. But what can you tell us about this particular outbreak and its origins, and why has it come back?
Well, I mean, Ebola just is something that is in the environment in the sense of animal reservoirs, bats and other animals. So when you have first a jumping of species is what happens. So very likely in West Africa, the outbreak was traced to a boy in Guinea who likely was playing in an area where there were bats. That boy got infected. And then at the funeral for the boy and members of his family, it spread. And then we had the enormous outbreak that you mentioned in West Africa. It is very likely that something very similar to this happened and was the origin of the outbreak that we're currently experiencing in the DRC. Very likely came from a jump species from an animal to a human, because there was no Ebola in DRC prior to the outbreak. And that's how it actually happens. It jumps species from an animal reservoir, whatever that is, being a bat or another jungle animal, as it were. Right now, you know, it's very serious. There are about 2,600 cases and about 16,000 deaths with a mortality of approximately 60%. So this is very clearly on the high side of the outbreak in numbers. It's the second largest outbreak in the history of Ebola. The largest was the one that we experienced in 2014 and 15 in West Africa. But this one clearly is the second largest and is still continuing to be an ongoing challenge, because it's not really getting any better. And that's one of the things that's challenging everyone who's trying to respond to it.
All right, let's bring in Ted Alemayhu. He's in Los Angeles. And Ted, what is your assessment of this Ebola outbreak right now? You've been doing a lot of work on this particular disease and its outbreak, especially the one that took place in 2014. What are governments doing about it, especially the DRC government?
Well, look, it's really unfortunate that we're still talking about the Ebola virus and the tragic event that's taking place in the DRC. Let's go back in 2014 and 15 and what we experienced and what everybody was trying to do during that really absolute chaos time. During the 2014 and 15, we had approximately 28,000 cases, suspected cases, and over 11,000 people were murdered by this disease. And the countries like England, Italy, Spain, and even here in the United States, the virus was introduced through various means. And honestly, the world community was shocked and caught by surprise. And they didn't know what to do. The African nations were terrified. Everybody was overprotective of their territory, borders being shut down and flights being canceled. And governments across Africa were investing in Ebola monitoring system, and once you land at their airport, they monitor your temperature. It was a massive disaster. But thankfully, I think the United States stepped in, and the Obama administration put in some efforts, and the INH and the CDC and other global entities got involved, and they were able to participate in coming up with some kind of remedy to control this wildfire, this virus is just spreading like a wildfire. What's happening now is unless we manage this thing carefully and put together a massive response that's required to control this virus, I'm afraid that we're going to experience the same thing. Now, I'm happy to hear that the president of the DRC is stepping up, and I was actually prepared to criticize him, quite honestly, but I'm happy. I'm really, really happy that he's showing some solid leadership. And I understand the health minister is removed. I think he should be. And hopefully the president would declare national emergency in his country and encourage other African nations to rally behind him. One of the things that it was miscalculated, if you will, during the 2014 and 15 crisis was that almost every nation in Africa was in the defensive move versus really rallying behind those affected nations and help them in any way, shape, or form that was required.
Right. Daniel, what do we know about how this disease spreads? There is a vaccine right now. I mean, and there's also fears that this disease might spread into other countries, neighboring countries as well. How effective is that vaccine?
Well, the preliminary data that's been published by the World Health Organization on their website on April the 14th, based on approximately 91,000 people in the DRC who had received the vaccine during this epidemic, which is now 12 months old, it looked like the vaccine had a high level of efficacy. Yeah. The number that's cited is 97%. So that's very encouraging, but it's given in a very specific way, that is after exposure. Most vaccines we get before we might be exposed to the disease.
Right.
This is given to people who are contacts of someone who has the disease, and then the people who come into contact with those contacts. So it's a very specific way of giving the vaccine. It's sometimes called ring vaccination, which was used during the smallpox eradication program back in the 70s. So I think this particular vaccine, which is the only one that's been given to about 170,000 people, is proven to be effective in this specific setting, post-exposure ring vaccination.
Would the vaccine be more effective if it's given before people actually get the disease?
Well, this particular vaccine, I think we don't know for sure, because only some healthcare workers in DRC and also in Uganda and South Sudan and Rwanda have gotten the vaccine before being exposed, but as healthcare workers, they could be exposed to any given day. So there is discussion about a second vaccine, which has not been used. It is also still an investigational vaccine, which requires 2 shots, not 1.
Right.
That might be given best in the pre-exposure setting rather than the post-exposure ring vaccination.
Right. Olivier, what can you tell us about the use of these vaccines? We understand there is a shortfall right now, and there's a pharmaceutical company, Johnson & Johnson, which is going to introduce an experimental vaccine. And of course, there's another challenge for health workers, in that they have to try and persuade villagers who are very suspicious of this vaccine that they need to get this vaccine in order to combat the disease.
Well, Ebola is now a vaccine-preventable disease, and I think, as just mentioned, vaccines shown high efficacy. It's an incredible additional tool in our Ebola control toolbox. It's not to say that the other things don't need to be done, but it's certainly something additional, and that's hugely helped in this outbreak, despite all the challenges we mentioned, despite the fact that this is the second largest outbreak. Certainly, the vaccine has an important role to play in controlling that outbreak so far. Reception of the vaccine and the community perception of the vaccine, in my experience, has been good. The uptake by community health workers and frontline workers has been good on the ground. There has been a good understanding of what the vaccine is for. Clearly, the targeted approach and the ring vaccination approach brings also challenges. It's the right approach, certainly in the early stage of the epidemic, but also later on to be targeted from a scientific viewpoint. But it's not a vaccine that can be readily provided to everybody in North Kivu or Ituri, and it probably wouldn't make sense also in terms of Ebola control. So having a second vaccine in the pipeline is also good news, and I think it's encouraging to see that there might be other options moving forward as well.
Anthony Fauci, if we look at the international response from outside Africa to this crisis, China, the United States, as well as the United Kingdom, are helping. This is what their spokespeople and officials are saying right now. Let's watch this.
The United States is currently the largest bilateral donor to the Ebola response, and we will provide more in the coming months. However, this response requires all member states to step up support if we are to end this outbreak.
Going forward, we will continue to stay in close communication with the WHO, the DRC, and other African countries. In light of the development of the Ebola epidemic and the need of African countries, we will continue to provide as much help as we can.
The British government has so far put in approximately $45 million. I've just authorized up to an additional $63 million from the British government.
So, Anthony, in terms of international funding and international assistance, what would you like to see?
Well, certainly we need more resources. I mean, this is a problem that is not yet under control. The World Bank has pledged yesterday or the day before an additional $300 million, which I think is very much needed and I think will add to the effort. But as the individuals who you just put on the program now, when you gave the recording of their responses, we need a clearly more effort among multilateral donations and multilateral involvement. In the West African outbreak from 2014, there was a considerable amount of input from a number of countries. Hopefully, as we now are trying to really jumpstart and get this thing under control with the recent moves that have been made by the government of DRC, by the declaration that this is a public health emergency of international concern, hopefully that will trigger and stimulate a lot more input from other countries, which is really needed if we're going to get this under control.
And Ted, what do you make of the international response to this crisis?
Quite encouraging. And then I think last time we've learned a lot. The international community and some of the largest humanitarian agencies and what have you were slow in responding during the 2014 and 15 Ebola outbreak. This is truly encouraging to see that we are seeing the World Bank and others playing a critical role with regard to, obviously, providing funding. But also we need medical manpower. I think the country needs that. They also need medical equipment, supplies, and other protective gears that volunteer doctors and nurses and other healthcare professionals would need. In addition to that, and I think, look, I mean, they got to have some kind of technical support, and laboratory experts, and health education that needs to take place. But one of the things that I think most people neglected during the 14 and 15 Ebola outbreak is the importance of traditional healers on these West African nations and other parts of the continent. Look, these folks are so powerful. In fact, in some cases, more powerful than health ministers. And then I think as people are kind of scrambling to get to solve these issues, they completely neglected this massive influence these traditional healers have on the ground. And so I think this time around, I'm hoping that not only the government of the DRC, but even the international community, as they look into assisting the situation to take into consideration and educate them and provide them with the necessary information, if you will, that doctors and medicine, what have you, come into those countries is to help people, not necessarily to harm them.
Daniel, Ted raises an interesting point there, and that is the medical manpower that is needed. You've worked in these areas. You've worked trying to combat this disease. What do we know about the kind of healthcare network that's needed on the ground there, and not just the formal healthcare network, but the ones that he's talking about, the informal network as well?
I agree with his point wholeheartedly. It's essential, just like it was in West Africa, to involve not only traditional healers, but the entire whole of society, we say, because you can't stop an Ebola outbreak just with traditional medical interventions. You need the community to be engaged and willing to do what's necessary in terms of changing behavior so that the virus is not transmitted through close physical contact. Fortunately, Ebola is not spread through the air, but you need not only traditional health providers, traditional healers, but really everyone in the we say the community, but it really is multiple communities. And the area of these two provinces, North Kivu and Ituri, is a very, very large area, approximately a quarter or a third the size of the United States. So there's many people who live there, close to 10 million people. So it's a very big undertaking and quite a variety or multiple different communities.
Right. And you do need community leaders to step up, don't you? Because as I said earlier on, there's deep suspicion of the vaccine for one, and of healthcare workers themselves.
And sometimes particularly foreign healthcare workers, yes. So I'd go back to what you showed at the beginning of the show, the interview with Dr. Jean-Jacques Mayombe, who really is a living legend, in my opinion. I met him in Kinshasa in 2016. He was at the first Ebola outbreak, and everyone since then, this is the 10th in the DRC. He's a medical doctor, a PhD, a true living legend. And what he said was, on the interview, what I understood him to say is that we need to have communication by people who speak the local languages, who can most likely gain the trust of the community. That's essential. Trust is the most important thing.
Anthony Fauci, of course, there are all different kinds of views on how to treat this outbreak. One came from David Miliband, who is the head of the International Rescue Committee. He's a former United Kingdom Foreign Secretary as well. He says that this current response is not working as the outbreak is in an active conflict zone. It needs to be treated as a humanitarian emergency. What do you make of that, and what does that change?
Well, it really, I'm glad you brought that up, because, you know, you could put people into the mix of getting into the, you know, grassroots in the trenches to try and do the contact tracing and all the things that you need to control the outbreak. But this is very unique and very different from the outbreak in 2014-15. The security issues are profound. It's a security problem, it's a humanitarian problem, it's a public health problem. It's all of the above, and that's the reason why the response is so complicated here, and why, under other circumstances, we likely would have gotten this under control, but we don't. I mean, a typical example, the security issues are preventing a large number of the CDC personnel, who are usually right there in the trenches working on the line, are not allowed to go in at this point because of the security issues. They're training people, they're doing the best they can within the areas that they are, but we can't get as many people on the ground working at the community level because of the security issues. So I think we better really appreciate that the violence and the security issues are playing a major role in inhibiting the response to this outbreak.
Olivier, we're also hearing of healthcare workers themselves who are being infected with Ebola. I mean, how do the risks multiply when that happens?
So I don't have all the details of those particular events, but clearly with the vaccination program now, one of the targets is obviously frontline workers and healthcare workers. The reason being that they're the most at risk, and there's a very large network of both formal and informal care in North Kivu. People will visit both traditional healers or what they call tradi-modern healthcare facilities and more formal healthcare facilities as they become unwell. And if the virus is not recognized at that stage, or if sometimes people need to go to 1, 2, or 3 different healthcare facilities before it is being recognized, this poses a high risk of transmission to healthcare workers, but also to fellow patients. So in that sense, that's why the vaccination program, certainly at the very start of the outbreak, not only was used among close contacts of identified patients, but also certainly was targeting healthcare workers. I didn't really hear the full question, so I'm not sure if I'm answering your question here.
You did answer it. Thank you so much. One final point I want to get to, and Ted, I want to get to you for this. Where do efforts to combat the outbreak go to from here? If we look at the United States, if we look at where I'm sitting right now, have any kind of representations been made to the Trump administration?
That's a very good question, and I think the USAID is scaling up their assistance, as I understand it, and I'm not sure if the president of the White House is fully informed in this, but one thing I can tell you is that I'm out there talking about it, and I plan to write a letter to the president directly so that we can get his full attention, and so the government is able to, as always, be as generous as they can to the continent, and particularly in this case. So I'm hopeful, and I'm confident that the president will be quite generous.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.